Samantha Alexander, CEO and co-founder of bitewell.
So we work with both health plans and employers to bring healthy food as a sponsored benefit to employee populations and member populations.
And what led you to it? What's your story?
What's my life story?
And who's your tailor, by the way?
I mean, thank you. What's my life story? So I grew up in the Northeast in a big Italian family. And food was the center of our family.
Surprise, surprise.
Surprise, surprise. When I was 12, I lost 30% of my body weight in a 6-month period, and we couldn't figure out why. We ran every test under the sun. And finally, my pediatrician said, I think we should test you for lactose intolerance. And we did, and it turns out that I was severely lactose intolerant, and it had led me to lose all this weight. And so I had to completely change the way that I ate, and my family had to completely change the way that we ate. Wow. Fast forward a couple years, my sister, my cousins all had similar issues, diet-related issues, that caused my family to change the way that we ate as a family. So I've always been very passionate about this space. Mm-hmm. But I didn't work in healthcare for the majority of my career, so I was solving big problems in the beauty space and solving big problems in the financial services space until mid-2020, when I learned that about 75% of our healthcare dollars go toward treating diet-related diseases. Depending on who you ask, some people will say 80, some people will say 85. The number doesn't go below 75. And I realized there was a big problem to solve in the healthcare space that I could solve using my personal passion around food.
An evangelist.
I guess so.
So what does what the product does today is something really, really interesting, similar to, you call it the credit score for food.
Yep.
Can you tell us more about that?
Absolutely.
Very fascinating.
Absolutely. So everyone is either eating or has eaten lunch. So by a show of hands, how many of you know with certainty how the lunch that you ate impacted your health? Anyone? We've got like
just a
smattering of hands. So that's what we help you to do. Essentially, when we stepped back and looked at the data around food's impact on health, we realized that the food as medicine movement was beginning to grow.
Yep.
And if we subscribe to the belief that food is medicine, why are we not covering the cost of food in the same way that we cover the costs of medicines that treat these same diet-related diseases? And when we broke that down and tried to figure out why, we realized that there was limited specificity, limited guidance, limited ability to help me or you navigate your food choices through the lens of your health. And so we developed a proprietary scoring system. We call it the Food Health Score, where we can tell you on a score from 0 to 10 how the food that you're about to eat or buy will impact your health. And through this scoring system, we can nudge you to make better and better food choices. And through this scoring system, we can unlock funds for you that help you to reach your next health goal. And so we've created some structure around the idea of food as medicine and bringing that to life for a person in a way that a person interacts with food in the world.
Yeah. You know, working in the, as I mentioned earlier, in the social determinants space, there's been a lot of very interesting discussions around sort of, looking at the non-clinical services, to prescribe them, right? Prescribe housing, prescribe transportation, prescribe the kind of services that would help, again, upstream, so that we reduce downstream clinical the cost of clinical care. So have you had discussions similar like that? I mean, what has been your experience working with employers, payers, providers? Are you talking to doctors?
Yes. So we talked about this earlier today. I think there's been a lot of early exploration around prescribing healthy food, which I think is fantastic.
Yeah.
But as a healthcare industry outsider, truly coming into the space, and as a user who feels this pain, I think we may be limiting ourselves if we are saying you can only get access to healthy food benefits through a provider prescription. What if I just want to access them through my plan that's sponsored by my employer, sponsored by the government? Do I need to go to see a doctor to get access to a healthy food benefit? I think there may be ways that we can break down barriers even more by offering these benefits through plans.
Okay. Yeah, you don't need to go to a doctor to eat food.
Exactly.
Right? So
exactly. Although it's wonderful to, and I would love every person to, get a prescription from their doctor for healthy food when they're going in for their annual visit, but I don't think that should be the only way. And we've developed a way to do that, either in concert with or without a prescription.
Absolutely.
Now, for individuals, what type of information are you gathering before you pronounce a food score? Do you look at genetic data? Do you look at medication history? How do you make up a profile? What makes up a profile?
Yeah, so there are a bunch of different factors that can go into that. So we look at allergies and intolerances and diet and lifestyle preferences, medical conditions, medications. We look at your goals. We also can pull in DNA, lab data. There's a whole bunch that we can pull in because of the connected digital health ecosystem that has emerged.
Pivoting a little bit about your journey as a founder and an entrepreneur, what are some of the challenges or maybe advice you could give to current and future budding entrepreneurs and founders?
Sure. I would say
Come from a large Italian family.
come from a large Italian family. Eat a lot of good food. No, I think don't be afraid to do something different, to break the current system just enough, right? You can't break it entirely because then you won't commercialize. But if you can break the system just enough to drive value for the people who you are really trying to serve, the end user, the end member, the end patient, you will succeed. And that's a scary thing to do, especially when you are within industry. I think I have, in some ways, I have the benefit of being an outsider, so I don't have to unlearn things to relearn them. I'm coming at this from the perspective of the end user who needs this deeply and is building for that person and trying to figure out how it fits into the system.
The famous Steve Jobs, think different, right?
Think different.
That's your...
That's great.
All right.
Sam, thank you very
Awesome.
much.
Thank you.
Thank you.